Good morning, friends. Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe to my channel and also please give your valuable comments. You can also visit the playlist. In the playlist, I have provided almost all the topics in a very systematic order. You can make use of it. My dear friends, we have been discussing about the DSD, and in the last class, we have seen that how the formation of the aldosterone and formation of the cortisol will be blocked when there is absence of one particular enzyme which is called as 21 alpha hydroxylase deficiency, because for the both pathways of aldosterone and pathways of this cortisol, 21 alpha hydroxylase enzyme is very important. If this particular enzyme is present, then only the next step will take place. So absence of this particular enzyme will going to lead to blockage of formation of both aldosterone and as well as cortisol, and as a result the precursors which are present, so they are not diverted into the third pathway, that is androgen pathway, and there will be excess production of the androgens, which leads to early virilization and changes. So today we will discuss about this 21 alpha hydroxylase deficiency, the enzyme which is most discussed. And this is the enzyme that is 21 alpha hydroxylase deficiency. So because of which the progesterone is not get converted into the next stage of corticosterone, and here also this particular 17 OHP progesterone is not get converted into the deoxycortisol, which leads to formation of cortisol, and as a result these two precursors, so they take another route, diverted into another route of androgen formation, and as a result there will be excess formation of the testosterone or estradiol. Now coming back to this 21 alpha hydroxylase deficiency, why this happens? This is an autosomal recessive problem. Recessive problem means most of the time recessive problems are related to recessive trait problems are mostly related with the metabolic problems, body metabolic, maximum body metabolic or enzymatic problems, enzyme deficiencies, inborn errors of metabolism, etc. So they are basically a recessive type of disorders. Anyway, so this is also an autosomal recessive type of disorder. The most common type is congenital adrenal hyperplasia. Okay, so now 21 alpha hydroxylase, 21 as we have already shown in the table, 21 alpha hydroxylase enzyme is very important for the formation of the aldosterone and also the cortisol. So in the absence of this particular enzyme, this is not formed. So aldosterone is in low level and when there is aldosterone in low level, and that leads to hypotension. Okay, the reason is aldosterone is nothing but otherwise also called as mineralocorticoids, and that is very important for the absorption of the sodium and water, etc. So when sodium and water retention is not there, so then naturally it leads to the hypotension. And meantime, as I told, as these precursors are directed to the other pathway, there will be excess production of the androgen. So due to less aldosterone, naturally what happens is there will be hyponatremia, hypokalemia, and also hypoglycemia. So now due to less aldosterone, these are the sodium absorption will not take place, therefore that leads to hyponatremia. And when the sodium absorption is affected, naturally the potassium absorption and this exchange is also get affected, that leads to hypokalemia, and hypoglycemia will be there. So hypoglycemia is basically because of the absence of the cortisol. Anyway, so this is actually happens. That means aldosterone and as well as cortisol both are not formed. That leads to the series of changes like hyponatremia, hypotension, hypokalemia, hypoglycemia, and some immune changes, etc. But we should understand 21 alpha hydroxylase deficiency is there, but ACTH, adrenocorticostimulating hormone, ACTH is continuously stimulating the adrenal gland. Okay, so the stimulating hormone from the pituitary gland, that is ACTH, that is continuously stimulating the adrenal gland to produce more and more aldosterone and as well as cortisol and androgens. But unfortunately this enzyme is present. In spite of that stimulation, the gland is not able to produce these two hormones. So as there is already this stimulation is coming continuously, That leads to hyperplasia of the gland. Although there is hyperplasia, unfortunately the gland is not able to produce the cortisol and as well as aldosterone because there is absence of 21 alpha hydroxylase deficiency. Now, meantime, these precursors are diverted into the androgen pathway and there will be more production of the androgen. And if it is in case of female, suppose the child, if it is female, then there will be virilization because androgens are not formed. Basically, problem is alpha hydroxylase deficiency. Aldosterone not formed, cortisol not formed. Therefore, the things are diverted into the androgen pathway. If it is a female child, it leads to early virilization. The secondary sexual characters will go into develop in that child very early. Okay, early virilization. And there will be also clitoral enlargement. Clitoris is also get enlarged. And there is also increased facial hair. And there will be deep voice and increased libido, and also male pattern of baldness can be seen. So these are the presentations of 21 alpha deficiency, hydroxylase deficiency in female. But if it is a case of male, this early virilization will not cause much problem because for the male, if the facial hair is coming earlier, nobody will be much worried. Okay, but there will be precocious puberty. Precocious puberty will be there. Puberty will be attained at the earliest, but nobody will going to worry much if a male child get the virilization or facial hair and all those things at the earlier. Now, talking further, this particular 21 alpha hydroxylase deficiency is of again two types. One is classical and another one is non-classical. One is classical and another one is non-classical. So in classical means it is a complete deficiency. Okay, as a whole, whatever the genetic problem is there, so that gene defect is there, that gene defect is causing a whole complete blockage of the production of the particular enzyme. Okay, so if completely there is complete deficiency of alpha hydroxylase deficiency is there of alpha hydroxylase enzyme, then usually we will call it as a classical type of a disease, classical 21 alpha hydroxylase deficiency. While another one is there, that is non-classical. In non-classical, what happens? It's a partial deficiency. Okay, 50% is working, 50% is not working. So, okay, now in partial deficiency, the problem is not much as there is no salt wasting. Now, what actually happens is when we talk about partial deficiency, 50% of the hormones are produced normally. Therefore, the 50% of the aldosterone is also produced, 50% of cortisol is also produced. Okay, so therefore what happens, there will not be no drastic problems or complications like salt retention. Salt retention is affected, there is no sodium absorption, hypokalemia. So these problems will not be there up to a greater extent. Only yes, it will be there, but up to the less extent, and it's not causing any pathological changes. This is the beauty of the recessive disorders. Okay, in the recessive disorders, this do happens. Because if the one allele, mutated allele is not working, another allele will go into work. Therefore, that's a different discussion. Therefore, the 50% is working and 50% is not working. So, in such condition, that is a partial 21 alpha hydroxylase deficiency, there is no much problems like hypotension, there will not be any salt retention, that is salt wasting and hypotension, etc. But there will be more development of the acne will be there, hirsutism may be there, and irregular menstruation may occur in case of females. Because anyway, 50% is working, 50% is not working. That remaining 50%, which is not get converted into the next stage, so that will be diverted into the androgen pathway, and there is a comparatively more amount of androgen production. So this leads to simple some acne, excess acne or hirsutism, and in female it is irregular menstruation, etc. Okay. So, what is the diagnostic criteria now? What is the diagnostic criteria? So, in case of 21 alpha hydroxylase deficiency, the prior precursor will be more in the blood, so there will be increase in the 17-OH hydroxylase progesterone. Now, this is very important. How we will go to diagnose? Suppose if there is 21 alpha hydroxylase deficiency is there, then the prior precursor will be more in the blood, so that there will be increase in the 17-OH hydroxy. If you look into this particular table, see 17 hydroxy progesterone is there. Okay, so before the cortisol this will come. Okay, so if there is 21 alpha deficiency, 21 alpha deficiency is there. Okay, if this deficiency is there, then the precursor amount will go into rise, isn't it? So here the progesterone will go into rise, and here in this case 17 OHP progesterone will go into rise in the blood. So this will be the diagnostic criteria. Further, there will be less aldosterone and more androgen. Okay, so treatment will be supplementation of the aldosterone and cortisol. In this condition, what you have to do? The treatment is supplementation of aldosterone and as well as cortisol. Now, these are the three important types of 21 alpha hydroxylase deficiency. Okay, now this is basically divided into three types. One is salt wasting type, another one is simple virilization type, and another one is non-classical type. Now, salt wasting type is a severe form, that is complete enzyme deficiency. There is no production of the enzyme at all. 21 alpha hydroxylase is not at all produced. That leads to complete blockage of the enzymatic activity. So you will have severe salt wasting there. Severe salt wasting may lead to hypotension may lead to shock, and then dehydration, hyponatremia, etc. So severe symptoms will be there. And what about the aldosterone synthesis? Very, very low or nil. Okay, so what is the age actually when it is diagnosed? Usually infancy, because if there is complete blockage of the enzyme, the presentations will be started earlier, within 1 or 2 months of maybe even 15 days after delivery, the child will start with the problems. Talking about the virilization, when the virilization takes place, that means sexual characters when it develops, it will be severe. If it is in case of female baby, okay, if it is a female baby, at the birth itself, the child will have male-like external genitalia and labial fusion and clitoral enlargement. The incidence is about 1 in 20,000 babies. This is the severe type of 21 alpha hydroxylase deficiency. Then what is simple virilization type? In case of simple virilization type, enzymatic activity is affected only up to 1 to 2%. Okay, so it's a simple virilization. Okay, maybe about 10 to 20% is get affected. Okay, 10 to 20% of the enzyme activity is affected, 80% is running on, so no problem. So there will be simple virilization, only few amount of the androgens are formed more, and there is again no salt losing, as aldosterone is almost all near normal. Aldosterone synthesis is normal, cortisol synthesis is also normal. Now, age of diagnosis, infancy in females and childhood in males, because if the so how the virilization is moderate to severe. For the female there will be virilization, for male it is not diagnosed, it is normal as it is normal for the male, and incidence is 1 in 50,000. Now come to the last one, that is a non-classical. So non-classical means about 20 to 50% of the enzyme activity is there, 50% is not there. This is already we have discussed. Okay, so aldosterone synthesis is also normal here. Okay, so child is totally asymptomatic till adulthood, and virilization none to mild. Virilization is very less. Okay, virilization is very less, none to mild, very mild variety will be there, and incidence is 1 in 400. So now the last question is why this deficiency occurs. So there are two genes actually which are responsible for this enzyme, CYP21P and CYP21. Now the deficiency occur, genetic problem occur because of this problem. CYP21 is the active gene which is responsible for the production of alpha hydroxylase enzyme, whereas CYP21P is a pseudogene actually. It's a pseudogene. But both are about 90% identical in their DNA sequence. Although it is a pseudogene means it looks like that, but it is not actually having that capacity of producing that particular required proteins and all. So both are looking like same, therefore it is pseudogene. So but both are about 98% identical in their DNA sequence. So in pseudogene there is 9 different mutations which is not present in the active gene. Otherwise both are identical. That's the only difference. Now what happens in 21 alpha hydroxylase deficiency, when there is recombination between the amino acids of these two genes, the mutated gene will enter into active gene. The mutated gene will go into enter into active gene. So depending upon the extent of inclusion of the mutation of this pseudo gene in the active gene, the function of the enzyme will be get hampered. Pseudo gene also looks like the active gene only. Okay, but the body is not able to differentiate it. Sometimes there is inclusion of the amino acids of the pseudo gene in the active gene. So depending upon the extent of inclusion of this mutation of the pseudo gene in the active gene, the function of the enzyme will be get hampered. So this non-reciprocal transfer of the deleterious gene is called as gene conversion. So this is called as gene conversion. So talking what happens clinically. Clinically what happens? When 21 alpha hydroxylase deficiency is there, the forward steps of the conversion is not possible, as I already discussed. So there will be accumulation of the precursors in the reaction, and which ultimately get into the pathway of androgen production. So there will be lack of aldosterone along with the overproduction of the androgens. So when there is no aldosterone, again the same thing we have already discussed, sodium and water will be lost, so presents with the dehydration and shock, and meantime the potassium is also retained, because if the sodium is not absorbed, potassium is not excreted. So hyperkalemia and arrhythmia will be there, and there is also no cortisol. One more problem is there is no cortisol also. So there is hypoglycemia which further contribute for the shock. So meanwhile androgen production increases. Okay, the main issue in female child there will be virilization and at the birth present with ambiguous genitalia. So but in a male child it may left undetected because child is having male external genitals. Increased testosterone will always produce the male sexual external genitalia, isn't it? So here testosterone is increased, right? So male child, okay, it is left undiagnosed, but around 10 to 15 days after the birth, sometime if the male child is present with a shock and dehydration, then we have to think about complete 21 alpha dehydroxylase deficiency because of complete salt losing type of a disease. So these three varieties we have already discussed. A simple virilization variety, presentation will be later and it is not much severe as a normal aldosterone form. Okay, so this is all about 21 alpha hydroxylase deficiency. In the next class, we will discuss about one more enzyme deficiency which leads to ambiguous genitalia. So that is 11 beta hydroxylase deficiency. So that we will go to discuss in the next class. Thank you very much.